Hi there. The subject tonight is not a comfortable one, urogynecology. Everything that people don't necessarily want to talk about, don't necessarily want to think about, but when things go wrong, it's good to know there are people you can talk to and a place where they can actually get fixed. I'm Lila Lazarus. Next to me, Dr. Paul Makala, a urogynecologist and the head of robotic surgery at St. Mary Mercy, Livonia, and one of his patients, Georgianne Van Usen, someone who suffered from a prolapsed uterus, incontinence, and we'll talk more to both of them. And of course, we want to include you as well in this discussion on prolapsed uteruses, incontinence, everything that you'll see tonight in Discover Remarkable, and we hope you enjoy that special as well. We want you to be involved in this conversation, and the number to call is 248-356-0077, 248-356-0077, with your questions for Dr. Makala, but also for Georgianne as well. And the nice thing about this is your questions are anonymous. You can ask openly and honestly. We don't see your face. And Dr. Makala, you're pretty easy to talk to.
I think so.
That's good. Didn't you find that true?
Dr. Makala is amazing. He's a great surgeon and very easy to talk to. He'll speak to you in layman's terms.
So people are going to watch Discover Remarkable, and they're seeing you actually as the star of the show. Tell us, Dr. Makala, what was it like being in this show?
It was really interesting. Just to see how you guys do business. I know how I do business, but to see how you guys do business and taking all the footage and then weaving it into a story was really interesting to see, because I saw a lot of filming of a lot of long segments of activity, and then seeing what you do with those pieces and how you tell the story was really interesting.
To put it into a show that's 30 minutes. Georgianne, this is not an easy subject for anybody to talk about. Not even to the closest people in their lives. You want to tell people, I pee my pants. Ooh, I got to run to the restroom. I've had an accident. You were not only willing to tell the people in your life, you were willing to tell the whole world. Tell us why.
Number one, my mother had the same issue. She's 80 years old, and she had surgery with Dr. Makala on September 15th of 2012. And my mother had prolapsed uterus, prolapsed bladder, prolapsed rectum. But hers was totally prolapsed from her vagina, just literally hanging out of her body. And when I found out I had the same issue, I thought, my mother was so embarrassed, I have to be able to do this, because people need to know there's nothing to be ashamed of, and if you need the surgery, you need to get the surgery, because I'm like a new woman. And so
nice.
is my mom.
That's so great. And you know, there isn't a face for this story. In other words, there aren't people who have been talking about this for years.
True.
I've never heard anyone talk about this publicly.
Mm-hmm.
Tell me a little bit about, first of all, what happened to your mom and how you finally found out and how she finally got help.
Okay. Last May, her birthday is May 27th. We were giving her a surprise birthday party for her 80th birthday. And she came down and she asked me and one of my sisters, there's 8 of us, if we could go and step into the bedroom. She wanted to show us something, and she proceeded to take down her pants. And I went, oh no, because I'm a nurse, I knew. I said, Mom, don't tell me you have prolapses. What? She says. I said, is something hanging out of you? And she goes, I don't know, you tell me. And she lays down and shows me this. And I said, Mom, your uterus and your bladder for sure. And I said, I'm not a doc, but maybe something else, I don't know. I said, we got to get you to a doc. You can't go back home. And that's what we did. And we met
Now,
Dr.
she
Makala.
had 8 children,
8 children. I'm the oldest, yep.
but you had the same condition and no children.
Well, that's true, and I asked Dr. Makala that, and he said sometimes it can be genetic.
Well, the
Or hereditary.
connective tissue varies from person to person, and so typically we think of this as a disease of people who've had multiple babies naturally and exert themselves a lot, but there certainly is a component of the connective tissue you're born with, whether it's elastic properties. So.
Right. And then I'm on my feet all the time, and I waitress my way through college to become a nurse, so maybe
people who lift, cough,
Yep.
are at risk.
Yep.
You know, so often I remember jumping on trampolines, and there was an older woman on the trampoline, and she said she had an accident, and she said it's because she had had so many children, but that's not necessarily the case.
Well, certainly deliveries are connected. That's probably the strongest factor that correlates in someone's history, but you don't have to have that as a feature, and Georgianne is a perfect example.
All right, we already have our first caller on the line. Karen, she has a question about her daughter having an issue with bladder leakage. Karen, you're on the line with Dr. Makala and Georgianne Van Usen.
Hi. My question is, I have a 21-year-old daughter, and her whole life she's always had a bladder problem. When she was a baby, I thought it was part of the training, the potty training. And as she got older, till about 5 or 8, I still noticed the dribbling. And then, of course, I get very private. And then the last couple of years, she's brought it to my attention, but she wasn't willing to see a doctor. She's 21 now. Of course, never been pregnant or had a child. And she still always has leakage. It's not when she laughs, just throughout the day, just throughout the day.
Does she get a sense that she has to urinate, and then on her way does she leak, or describe?
It's more this leakage. It's not a sense that she has to urinate. She doesn't get up in the middle of the night to urinate. She can hold her urine like the heavy, the major, like the big portion of it for long periods. Like she's too embarrassed to use the bathroom in public. She can hold it for a long time.
A big mistake. People hold it too long.
Right.
But
Yeah.
even after expelling, just walking or just throughout the day, there's
Yeah,
always
she's,
leakage.
with her being so young, she really needs to come in and see somebody and get an evaluation and figure out what she's doing and what's going on. And this is
That's
some.
what we were hoping. This program was perfect timing for us because we were just trying to find a female doctor for her.
Mhm.
Well,
Got it.
I think Dr. Paul Mackla is excellent, but certainly there's female gynecologists.
But let me ask you, doctor, because we think of this as something that happens to women over 50 and over 60. Do we also see it though, as this caller obviously does, with girls in their 20s and 30s?
They might have a different type of issue, overactive bladder, or the thing you'd want to worry about is there something underlying that's causing this problem.
Got it. And is this something that overactive bladder, can that also be treated in some of the same methods?
Typically, overactive bladder doesn't require surgical therapy. Physical therapy, medication are the two mainstays of treatment for overactive bladder.
So what would you suggest to our caller?
I think she definitely needs to be evaluated. She, you need to get a good history, physical, urinalysis, and see what you find there. And if that's not shedding any light, then she should probably have a test that's easily done in the office called urodynamics, and that should help understand what's going on with her. But she's too young to be having this problem.
Karen, I'm going to give out the number if you want to write it down. It's 855-SJ-ROBOT, the number to call for help. 855-SJ-ROBOT, or you can go to stjoeshealth.org/robotics. And I hope that helps to answer some of your questions. Karen, thanks for calling.
Thank you so much for taking my call.
Good luck with your daughter.
Bye.
Bye-bye. We have another person asking a question by email now. I find that I'm incontinent, Cynthia writes. It's mostly overnight. Can it be corrected?
Typically, yes. Patients, sometimes this is actually a form of stress incontinence. People will say, I don't leak when I cough or I sneeze, which is the most typical. But if I stand up or I sit up, I leak. Or sometimes when they're shifting around, when they're laying down, as they're sleeping, they wake up and they're wet. But often this is a form of stress incontinence. But again, usually something like this is easily diagnosed with right in the office.
Why is it that at night so many people feel that pain or that pressure more so than they would during the day?
Well, what's supposed to happen at night is your bladder is supposed to relax, essentially. You're supposed to be able to, the idea is that you get rest through the night, and so people typically can hold a little bit more urine in their bladder. They get less signals that they've got to go, but sometimes that just doesn't work. They either produce too much urine or their bladder's sensitive and then they have to go. And so it can be really annoying. I've had patients come in saying they have to get up every hour, every 30 minutes, and you just don't get sleep at that point. So it's really disruptive.
Yeah. So hopefully right now you're watching Discover Remarkable at the Heart of Medicine. The subject, of course, cystocele, prolapse uterus. Dr. Mackla is the surgeon who does the robotic surgery to help these women who have been suffering for a long time. How long did you suffer with this?
Oh gosh, probably a couple years at least. I knew I had a small cystocele like 2.5 years ago, but I thought it was okay. And then when I went to see Dr. Mackla, he said it was much bigger, and I also had, a prolapsed uterus and a prolapsed rectum.
In the easiest terms, tell us what cystocele is and what prolapse uterus is.
All right. A cystocele is basically the bladder bumping into the vaginal wall and pushing into the vaginal canal, and as it progresses, through the vaginal canal out of the body. The uterus is supposed to be maybe 6 or 7 centimeters deep in the vaginal canal, if you will, and with a prolapsed uterus, the uterus starts moving down the vaginal canal, and then sometimes through the vaginal opening into a complete prolapse, like what Georgianne's mom was experiencing.
So is that what is it that causes the pressure and the pain?
It's everything that's moving into, basically herniating into and through the vaginal canal. It's the attachments that are trying to keep those parts of the pelvis, or those organs of the pelvis, are being pulled, and that hurts. So there's a stretching, and then it's just the pressure of those, of the uterus and the bladder and potentially the rectum in a space they're not meant to be.
Describe the pressure or the pain that you felt day in and day out.
It wasn't so much pain as it was uncomfortable and embarrassing, because I had to wear peri pads in my underwear. And a lot of times when I would get out of the shower, I'd be drying off, and I would urinate before I got in the shower, knowing that I might urinate down my leg. And I would get out of the shower and bend over to dry my legs or my feet, and I'd start to dribble urine down my legs. So now I've got to get cleaned up again and try to hurry up and put my panties on, hurry up and put on a peri pad so I don't wet myself. So I don't have to do that anymore. So thank you, Dr. Makla.
Yeah, that was amazing. She didn't share that initially, and when she came back for the first post-op visit, she
That's
said
true.
she was really happy because she could take a shower, dry herself off, and still be clean at the end of that.
Yay!
So that was a big
It was great.
accomplishment.
Yep.
Let's get to Jeanette on line 2. Hi, Jeanette. You're on the line with Dr. Makala and patient Georgianne Van Usen. Jeanette?
Hello?
Hi, you're on.
Thank you. I have an issue with if I'm at a party or something like that and I start laughing, and I'm telling you, I just lose control. And sometimes I'll just start going to the bathroom, and if I'm, laughing and what have you, I'm thinking to myself, oh my God, I have no control to stop once I get that going. And I'm just wondering if this is kind of a symptom.
Can I ask you a couple questions, Jeanette? Can I ask you how old you are?
56.
And do you have any children?
Yes, 3.
All right. Do you lose urine at any other times if you cough or sneeze or laugh or lift? At other times, if you're not, you mentioned being at a party, but does it happen other times?
No, I haven't noticed that. Mostly just kind of, with this laughing thing, getting yourself going, and it's just, I really don't have any other symptoms.
Yeah, it's suspicious for stress incontinence. That's classically, you cough, you sneeze, you laugh, you lift, there's pressure increases in your abdominal cavity, pushes on the top of the bladder, and it forces urine out. It's not to say that it couldn't be some sort of overactive bladder, but odds are it's stress incontinence. But again, it's something that is pretty easily figured out in the office, and then you can have a variety of treatments, both surgical and non-surgical.
Whatever you do, don't stop laughing.
That's right.
Definitely,
Thank you.
definitely.
All right, Jeanette, good luck to you. What's the best part of helping women get their lives back? Because this is a whole new gal over here.
Right, right. Well, previewing the show is just seeing people resume activity that they had been passing on. For Anne, skiing, and for Georgianne, just being herself that she wanted to be. And so many people come in and tell me stories of things that they're not doing. They're not exercising, they're not going out. I had one patient who came in and she said she didn't like to leave the house, and she pretty much spent her entire day sitting in the kitchen because it was the only non-carpeted part of the house, and she didn't want to get anything on the carpet. So people really, it's surprising how this impacts people. So giving them that freedom to do what they want to do is really pretty powerful, pretty satisfying.
We know how incredible it's been for Georgianne. What are some of your other patients saying about surgery?
Well, one patient came in and she had surgery. She had surgery now about 2 years ago, and she'd had a surgery 5 or 6 years ago. It had failed very quickly. She was very discouraged. She was very skeptical about doing something, but she came in and she decided to do something, and it worked very well for her. And she came back at one of her post-op visits, and she said, quite frankly, it was the best thing she'd ever done for herself. And that's pretty powerful. We think of it as a surgery and it's going to stop a problem, and we're kind of clinical about it. But for patients who are living day in, day out with it, when you take that away, it's pretty amazing to them.
Let's go to line 3. Diane's on the line. Hi, Diane. You're on with Dr. Makla and patient Georgianne Van Usen. Are you there, Diane?
Hello?
Hi, Diane.
Hello?
Hi, your question?
I can't hear you.
Can you hear me now?
No?
Well, you must be able to hear me a little bit. What's your question?
Well, you sound like you're in a tunnel, but I'll tell you. My question is, I have all the problems of pelvic prolapse, but I also have an additional problem because in 2009 I had a CVT sling put in, and I'm worse off now than I was before the sling was put in. And what I want to know is, do I still have this option to have the surgery for the pelvic prolapse?
Was it a TVT sling?
Hello?
Hello, can you hear me? Well, the short answer is yes. A lot of what I do is working with patients who have had other procedures, and now something isn't working, something has failed, and I call them redos. You know, we try to, we don't try, we actually fix these problems, but that wouldn't stop you from having, if you have prolapse, there's a variety of treatments for prolapse that can still be done if you've had a previous bladder sling.
Well, I know I definitely know I need the surgery because I'm kind of tall. I'm like 5'8", and for an example, I can be standing in the kitchen doing dishes or cutting up vegetables, and if I just slightly lean against the counter, I instantly leak.
Right. Yeah, it sounds like the sling. How long ago was that done?
In 2009.
That's not that long ago, but sometimes they fail. Sometimes if you don't address all aspects of the problem, if you only address the stress incontinence and you don't address the prolapse, sometimes it's a setup for a quick failure in some patients. So that's why it's so important to fully diagnose everything and fully treat things. You know, sometimes patients will come in and they don't want to have an extensive surgery. They want to go the easy route. And as long as you go in eyes wide open and you know that just by having a sling it might be a setup for a problem down the road, at least you know, and you make a good decision with all the information.
Diane, how much is this interrupting your life?
It's interrupting my life completely. It's interrupting my husband and I's intimacy. It interrupts my life as far as a lot of my activities. I don't dare ride a bicycle anymore, stuff like that. I'm a very active person. I'm somebody that snowmobiles. I don't dare hit a bump on a snowmobile or anything like that, you know. I got to be careful when I go grocery shopping as far as lifting bottles of water or stuff like that. I'll leak. You know, it's terrible. It's just terrible.
Do you wear any peri pads when you're going out in public?
Oh yeah.
Okay, and you're still going through them? Is that what you're saying?
Sometimes.
Okay, then you
Sometimes.
really, if my recommendation, I would see a doctor and find out if they can redo your surgery,
Oh yeah, definitely.
you know?
More than likely you can be successfully managed and you can resume a lot of those things that you're not doing right now. I would encourage you to seek care.
So would
Hello?
I.
Yeah, they're both encouraging you to get some help. The number to call for St. Joe's is 855
855
SJ Robot.
SJ Robot.
Correct, like St. Joe's Robot. 855 SJ Robot. All right?
855 SJ Robot.
That's correct.
Okay.
All right, we hope you get the help you need. Thanks so much for calling. Enjoy the
All right,
show.
thank you.
All right, bye-bye.
Bye.
You can also follow us on Twitter at #DiscoverRemarkable or call us here, 248-356-0077. We have more callers on the line. Let's go to line 1. Cassandra, you are on the line with Dr. Makala
She
and
hung up.
patient Georgianne Van
She
Usen.
hung
Oh, Cassandra, you're gone. How about Alice on line 2? Alice, are you with us?
Yes, I am.
Hi, Alice. What's your question for Dr. Makala?
Well, as I told the person that I spoke to before, I've had this surgery about 5 to 8 years ago at Henry Ford Hospital, and it was a sling that they inserted to elevate my bladder. So, having said that, I'm wondering, how is your surgery? I still have incontinence, and it hasn't stopped. Not, before the surgery, I had incontinence. After the surgery, I had incontinence. And I'm wondering, how is this surgery going to improve my situation as far as stopping the incontinence, and how would you go around that surgery that I had, take out that sling? Just what would your procedure be?
Well, typically, you need, once again, you need to have a full reevaluation, physical exam, maybe a cystoscopy, maybe an ultrasound, certainly urodynamic testing, and then you have to see what's going on right now. But the fact that you had a sling and it's not working, usually it doesn't get in the way. We don't typically have to take them out. We can work around it, if you will. And, again, like I told another caller, often what happens is a sling is placed and it addresses one issue of the problem. It doesn't address all the issues that are going on in the pelvis in so many patients. So, and it's possible maybe something changed since you had that surgery. But it's a little suspicious when you say, I had a problem, I was leaking, and I had a sling, and I'm still leaking. You certainly need to figure out why that is. Do you get a sense that, well, describe when you leak now. Do you get a sense that you have to go, and then a few seconds later you leak, or do you cough or sneeze and leak?
No, I always have the feeling that I need to go to the bathroom.
Mm-hmm.
And sometimes when I go, it's just a very little bit that is that I let go.
Mm-hmm.
Or there are times when I have to go. It's like urgent.
Mm-hmm.
I have to be at the toilet as soon as possible because I will go on myself. I have no bladder control.
Right. Well, that could very well be overactive bladder. Some slings are meant to stop leaking with a cough, sneeze, laugh, or lip primarily, but then you can have leaking with urgency, which is often better controlled with medication and or physical therapy. So, in your situation, I think office evaluation, again, urodynamic testing would probably give us a lot of good information and give us some solutions, potential solutions. But I'm pretty confident that is a problem that could be fixed.
Alice, the number to call if you want to is 855-SJ-ROBOT. We're glad you called in.
Can you repeat that, please? It's
855-SJ-ROBOT, as in St. Joe Robot. 855-SJ-ROBOT.
Robot. Okay.
Is it
And
tough?
I can ask some more questions.
Yep. Is it tough for you to talk about this openly, Alice?
I'm sorry. Can you repeat that? I can hardly hear you.
Is it difficult for you to talk about this openly?
Not really. Because I know that I'm not alone. I know that there are a lot of women,
That's right.
different ages. My daughter has it. And she says she piddles, if for no reason at all. Just any reason.
Right.
So it's a well-known fact that people have this, and it doesn't matter what age you are.
Right.
Mm-hmm.
All right.
So I don't have a problem talking about it. I'm just looking for some answers.
Yep. I think you and a lot of people. Thanks for calling. 855-SJ-ROBOT. If you want to join the conversation here, the number to call 248-356-0077. Let's go now to Chris is on the line. Chris, I understand you have a frequent urge to urinate.
Yeah, I'm always running to the bathroom, and then sometimes I have the sudden urges.
How long has this been going on?
Pardon?
How long has this been going on?
Well, it's been quite a few years. When I was working, I had made sure that I knew where every place that I went, where the restroom was. I went to the bathroom before I seen my customer. And now that I'm retired, it's getting worse. It seems that I'm going to the bathroom a lot more, and always stopping on the road somewhere, and then sometimes when I just get up and I sit in bed, from bed, I feel like it's going to just gush out.
Sound familiar?
Oh yeah, very familiar. And you're probably wearing peri pads too, and that's not doing a whole lot of good, right?
I'm wearing 10 pads.
Yep. I suggest that you see a physician and get evaluated, like Dr. Mackler has been saying, urodynamic testing and a physical exam, and see what they can do for you, because you don't have to live like this.
Yeah, I know. It's just really getting to the point where I said I can't be doing this anymore. I wear a pad. I carry one in my purse.
I know.
Sometimes when I get to the stall in the bathroom, and I go in the pad before I even sit down.
I know. I've been through that, and I'm 60 years old. How old are you?
67.
Okay. Yeah, I would if I were you, I would definitely get a doctor to take a look at this and see what they can do for you.
Yeah,
but,
I don't have the problem, if I cough or sneeze or laugh.
Okay.
Dr. Mackler?
Chris?
What do you think?
Do you think you have prolapse? Has anyone ever told you you have prolapse, or do you feel a lot of pressure in your pelvis as well?
No.
Okay. Well, sometimes prolapse, when the uterus particularly is pressing on the bladder, it can make you have frequent urges, but it's also could very well be overactive bladder.
Okay.
So again, I've said it multiple times, but a good history, a good physical, and some basic office tests can probably sort this out, and then you can get some potential treatment options.
Okay, well, thank you very much.
Chris,
You're
thanks so much for calling. And Dr. Mackla, how often have you heard a story
very
just
common.
like Chris's? And how old is the average woman when they finally walk into the office and say, I got to tell you, I got a problem?
Oh, it's certainly, as you hit your 50s and 60s, we start to see more and more of this, but we see patients in their 30s occasionally with overactive bladder, and it's not unusual. But certainly 50s, 60s are probably the peak time, if you will.
All right, well, Chris, we hope you get the help you need. 855-SJ-ROBOT is the number to call at St. Joe. Let's go
Okay,
to
thank
line
you
one.
very much.
Good luck, Chris.
Good luck.
Letitia, you are on the line with RN, Georgianne Van Usen, and also Dr. Mackala. Are you there, Letitia?
Yes, I am.
What's your question?
Hello?
Do you have a question?
Yes, I do. I'm calling because I want to find out how urgent is this matter for me. I was scheduled to have Da Vinci surgery back in July for my fibroids. I have multiple fibroids. And the day before my surgery, they called and told me my insurance wasn't going to cover everything. I have been having consistent bacterial, like BV, bacterial vaginitis problems, and my gynecologist says that my fibroids are pressing down on my uterus and bladder. And I'm so afraid that if I don't get something done, I'm making things worse. And it seems like he's kind of stopped treating me because I guess he just doesn't know what to do. The last time I went in was about 3 weeks ago, and I thought, again, the BB had came back, and he said that it hadn't. But my body is changing. There's an odor, and I'm urinating a lot, and I just don't know where to go to get rid of these fibroids and to have the Da Vinci done.
How old are you, Letitia?
I'm 47.
Okay.
48 this
So
year.
you're not planning more babies, obviously.
Pardon me?
You're not planning more babies. So
I
fertility.
can't really hear you.
All right.
You're not planning on having any more children.
No, I don't have any children.
Okay. Well, again, it depends on the size of the fibroids, and we never know with fibroids. Sometimes they grow very slowly, and then sometimes they grow very quickly. If they're symptomatic, we usually leave them alone unless you're symptomatic. Sounds like you are. Without seeing your ultrasound and how many you have, it's kind of hard to know. But Da Vinci surgery lends itself very well to a minimally invasive approach to remove the fibroids. It's certainly, many of our patients go home the same day. In the old days, we'd make an incision, like a bikini cut, and remove the fibroids, and you'd spend 2 or 3 days in the hospital. With the Da Vinci, we can take out many fibroids and send you home the same day. So it's a real bonus for patients.
Right. And that's why it was suggested, but the surgery, I guess, was going to cost $20,000, and my insurance wasn't enough to cover it.
Yeah, I've never seen an insurance in the state of Michigan that hasn't paid for surgery for fibroids, particularly if they're symptomatic. We are running into more and more plans that have large co-pays and large deductibles, so that may be what you're dealing with. But yeah, that's a problem. So.
But if you want to call St. Joe, 855-SJ-ROBOT, we encourage you to do so. Letitia, good luck.
Okay, thanks.
All right, best wishes. Bye-bye. Let's go to line 3. Victoria has a question about medication versus surgery. Hi, Victoria. You're on the line with Dr. Mackala and Georgianne Van Usen.
Hello, can you hear me?
Yes, we can. Can you hear us?
Not very well.
Okay. What's your question?
My question is, I guess my question is, why surgery? Did this particular patient try any medications? For instance, Gelnique, Vesicare, anything along that line?
Well, medications like you're talking about are meant for overactive bladder. So if you have urgency, frequency, that type of thing. But medication doesn't treat stress incontinence, and it certainly doesn't treat prolapse.
Medication what? I'm sorry.
Medication does not treat stress incontinence or
Okay.
pelvic prolapse. So it depends on what your problem is. That's why the office evaluation is so important. You know, we figure out if you have overactive bladder, we try medication and physical therapy. If you have stress incontinence, we typically go physical therapy, and if that doesn't work, then we do surgery. And with prolapse, it depends on the severity. If it's mild, you can get a lot of relief with physical therapy, but more severe in prolapse, you need to use a pessary or do surgery.
I see. So prolapse then sounds to me like the condition that was treated.
That's what I had.
Yes, the robotic procedure treats prolapse,
Okay.
Right.
and that's often part of, in addition, many times when we treat prolapse, we are also supporting the neck of the bladder. That's, some people call that a bladder sling, and that's to treat loss of urine with a cough, sneeze, laugh, or lift, and medication won't treat that condition.
Okay.
Right. Yeah.
Okay. I'm 66. I have, I guess, been diagnosed with an incontinence. I do take Gelneek, which really, it's wonderful. I mean, it really does help me with that. But I also have, I guess you could say, a fecal incontinence. Although my condition, quote unquote, is called IBS, which I guess I do have symptoms of that, but it's just something that I'm having a very, very difficult time with. I guess there's no cure for that.
For fecal incontinence?
Pardon?
For fecal incontinence, or?
Yes. For
Well, no, actually, we do have treatments for fecal incontinence. Typically,
IBS.
oh, IBS, that's a different situation. No, that's managed by gastroenterologists.
Right.
Right. But we do have treatments for fecal incontinence, including physical therapy, in some patients surgery, but typically we start with physical therapy.
So it sounds like you recommend physical therapy as, I guess, what, kind of like a cure or a management tool?
Well, certainly if you strengthen the muscles in the pelvic floor, a lot of patients will benefit. It's a question whether that improved muscle tone will actually improve your symptoms. Many patients try it and they either get they'll get relief, partial relief, or no relief, and then if they're happy, we stop, and if they're not happy, we move on to another therapy. But it's a good first step, a very simple, conservative first step.
Okay.
I think too, if I can say this, a couple years ago when I just had a really small bladder prolapse, cystocele, I tried the Kegel exercises. They didn't really do much for me. And then when I saw Dr. Makla, he told me that it was larger, and I also now had my uterus prolapsed and my rectum prolapsed. So when the organs are prolapsed, they have to be fixed, and like Doctor's trying to explain, the medication's not going to do a whole lot. And then again, you need to see someone and get, a physical and an exam so that they know what they're dealing with for you.
Right.
I hope
And
that helps.
I mean, I have. I just noticed your program, and I thought, gosh, is there something else that I haven't thought of or haven't done? 2 years ago, I had a sphincter muscle surgery where they, I guess, tightened this.
For the
area.
rectum?
Yes.
Right.
And,
Did it work?
I think not. I mean, I went to the doctor for a problem. He found a problem I didn't know I had. He fixed that, but it didn't fix my problem that I originally went with. And I don't know. It's just I'm trying to manage it. I'm more conscientious of fiber. I just never know where or when. That's my bottom line. So.
And there's a pun there, the
Yeah,
bottom line.
The bottom line.
Well, Victoria, I know it's been,
When I said that, I just thought, yeah, it's a pun.
it is quite a struggle, and I hope you do find the answers. I'm glad we are talking about it tonight, and I really want to commend you for calling in and talking so openly, and I'm so happy that we do have Dr. Makla here tonight and Georgianne, who are willing to talk to anyone who's got a question right now, and I hope you find the help you need.
Thank you very much.
All
I
right.
did record this, so I will go back over it and see if there's anything else that, maybe I should. I guess the only thing is, am I starting over, all over again? and, but maybe I can mention a few of these points to my doctor and hope that there is some sign of relief
Right.
in the future.
All right.
Thank you very
Good luck
much.
to you.
Thank you for the program. Very, very
Thank you for watching.
informative.
Great.
Okay.
Thanks for
Thank
watching.
you.
Talk to you soon. Bye-bye.
I know.
Let's go to line 2. Jackie's been waiting very patiently. Hi, Jackie. You have a question about your mesh suspension and incontinence?
Yes, I was wondering, I had the mesh surgery, and whenever I am on my period, it seems like if I cough or sneeze or whatever, it leaks out. Is that something normal, or is that something I should be having to look at?
I would say you need to be double checked. Did you have a bladder sling to support the neck of the bladder?
The urethral.
Okay. Yeah, you shouldn't, in a perfect world, when that type of procedure is done, afterwards you should not leak when you cough or sneeze.
Really? Okay.
Yeah. So you should be reevaluated to figure out if did it work initially and then fail, or has it just not ever worked for you?
No, it worked initially,
Okay.
but now it just seems like every time I'm on my period, which I shouldn't be, I'm too old for this.
How old are you?
And I'm 54.
54. Have you gone through menopause?
I'm sorry?
Have you gone through menopause?
No.
Okay. Okay. Well, some 54-year-olds still continue to cycle, but yeah, it sounds like something has changed, and you should be reevaluated to figure out what has changed and what can be done to fix it.
Okay, great. Then I will have that rechecked.
All righty.
Very good.
Well, thank you so much.
Thanks for calling in.
Bye-bye.
We hope you enjoyed Discover Remarkable. We're now chatting with Dr. Paul Makala, actually the head of gynecological robotic surgery at St. Mary Mercy, Livonia, and also emergency night nurse and patient, Georgianne Van Usen. How many weeks are you after surgery now?
A little over 7. I had surgery February 26th.
And now we knew before surgery, the doctor said, between 3 to 6 weeks you'll recover.
Right.
How quickly did you really feel like I'm back to myself?
I felt really good at about 2 weeks, but since I'm on my feet as an ER nurse, like Lila said, Dr. Makla said, not a good idea. I should be off at least 6, and he was absolutely right. Because I have to push carts and lift patients, and it's a lot of stress. I couldn't even vacuum or lift anything. But I felt really good after about 5 or 6 days. And right from the beginning, no more urinary leakage, no more peri pads. I gave them all to my sister.
Wow.
And she needs to go see Dr. Makla.
Now, also,
I think so, yeah.
I hope she doesn't mind that you just outed her.
That's okay. I didn't say her name.
Now, through it all, the other trooper in all this, the unsung hero is your husband.
Oh,
Because not only has he been a wonderful husband to you, as you've told us, but he was also very open about this and willing to talk about it on television.
Yes.
Tell us a little bit about Keith.
well, it's been hard for him too, because when you've got all your organs prolapsed into your vaginal vault, it's very difficult to be intimate with your spouse. So Keith, my husband's been very patient with that, and he's kind of happy now that everything's back where it's supposed to be, and so am I.
Talk about that a little bit, Dr. Makala. That's another
It's,
thing that people aren't comfortable talking about, but it's a big part.
Right. No, it is. It's just a whole series of problems that people would rather not talk about, and so some people are isolated. They don't bring it up with their family doctor. They don't bring it up with friends, and they just kind of live with it. So hopefully, a night like tonight, people will see this, that there is hope. There's something that can be done. Will motivate them to get out and get some treatment, get evaluated, and get better.
Right.
Let's see who's on line 1. Hi, you're on line with Dr. Makala and Georgianne Van Usen.
Hi, thank you for taking my call. I'm calling for my mom. She had a bladder suspension in her late 40s, and then she's had a few scopes, and every time she has one done, she has a burning sensation all the time, and she's woken every couple hours through the night. She goes to the bathroom, a couple drops, and nothing happens, and then it starts over again.
How is she leaking at all, or is it just simply?
No, just overnight, just a burning sensation constantly.
She hasn't slept for many years because it's always waking her. She feels like she has to go. When she comes to the bathroom, a couple drops and nothing happens.
And how old is she now?
She's 75 right now. She's going to a urology specialist coming up in May, but we live in Canada. We've been coming over to Henry Ford for some different tests, but I'm hoping to get her some help because I just feel so bad. She's been suffering for so many years.
Well, 75-year-olds sometimes have skin changes, atrophy associated with the lack of estrogen. So that's a possibility.
She's very healthy. She goes to the gym every day.
Yeah.
She has, her body's like 99.9 perfect, except this problem with her bladder, which is constantly burning.
Right.
And nobody can find out what it is that's burning inside.
Well, there's pain. There's a variety of things. There's menopausal changes. You can be healthy and going to the gym, but still have atrophy of that tissue, and it can be irritated. It could be overactive bladder. It could be painful bladder syndrome. There's a variety of things, but typically that can be sorted out. It's not. Sometimes it's a challenge, but as we chip away at potential problems, we can usually fix that.
Okay.
What type of doctors has she? What type of doctors has she seen so far that haven't fixed this?
This urologist specialists in Canada, they all have their specialists in their field. They've done different testing, but when they do a scope, it just seems to make matters worse.
Right. Well, if you're not having success, I would encourage you to find a urogynecologist. That's somebody that specializes in women, and sometimes it's not just a pure urology issue. It could be more, like I say, a menopause and lack of estrogen issue.
At her age, you think that would
Oh,
be
certainly,
happening?
certainly. Yeah, average age of menopause is 52, and it takes about 5 years for a lot of the change.
She had hers for a very long time. She went through a whole period where she had a really difficult time.
Right.
But would I be able to make a consultation appointment with your office? She will be happy to pay out of her pocket because we have no coverage in the U.S., of course.
Sure.
Absolutely. The number to let me give you the
consultation
telephone number.
appointment.
Let me give you the telephone number. You ready?
Yes.
It's 855-SJ-ROBOT. Or you can go to stjoeshealth.org/robotics. Either way,
I was
you
trying to get on the internet. I wasn't sure what website to go to.
yeah, stjoeshealth.org/robotics or 855-SJ-ROBOT is the telephone number, and the doctor here is Dr. Paul Makala.
And I can call and make a consultation appointment.
Certainly.
Yep.
All right, thank you so much. I really appreciate it.
All right, we wish you
Maybe
the very
we'll come
best
see
to you.
and see if you can help her out.
Great.
Yep, and you won't be disappointed.
Thank you. Well, when I turned the TV on, I saw this. I said, "Oh my gosh, I got to call in." I was so thrilled because this poor lady is just in so much pain all the time. She's so tired. She's walking into walls from not sleeping.
Wow.
No.
Yeah, it really does
It's just
disturb your
making
life.
it very difficult for her to exist.
Yeah.
Good luck with that.
Good luck.
Yep.
Our best wishes to your mom. Bye-bye.
Bye-bye.
Pat, you are on the line with Dr. Makala and Georgianne.
Hello.
Hi, Pat. You're on the line.
Oh, hello. This is Pat.
Hi,
I
Pat.
had a question that back in 2000, I had a VAG-HIS BSO AMP repair. Can that fall again after so many years and that you would need to have that redone?
Yes, the traditional A&P repair that you talked about, some studies show that failing in 50% of women at 12 months after surgery. So
That quickly.
yeah, in some cases. That's kind of why it's, in my mind, it's fallen out of favor. And that's why we're doing more of the robotic procedures. Or there's other sacrospinous ligament suspension is a great non-mesh procedure, or the robotic sacrocolpopexy. I'm not a big fan of the A&P
Now,
post
once
repair.
somebody has had one of those A&P or whatever,
Yes.
can they then have the robotic surgery? Is it still as effective?
Yes, many times. I'd say half the patients I'm doing that procedure on have had a previous hysterectomy and made a variety of other procedures, and it's very successful in correcting the reoccurrence of the prolapse.
Yeah, I don't have the urinary incontinence. It's the opposite. Sometimes I have a hard time going.
Right. Well, sometimes when you fix the prolapse can actually serve a purpose in that the bladder drops and it kinks the urethra in some cases. So you don't have incontinence, but you have exactly what you said. It's difficult to empty the bladder. When you fix the prolapse, sometimes we fix the problem. Not only do we fix the prolapse, but then we remove that obstruction in the urethra, and you in many cases we uncover incontinence that the prolapse has been hiding.
Okay. And it would be, doctor, are you a urogynecologist?
That's correct.
Okay. All right. And that is who I would have to go to for something like that.
Well, I'm biased because that's what I do, but I think that's going to give you a great solution for your problem.
And you should know, Pat, that now people are actually getting certified in just this area.
Correct.
Talk
Right.
about that a little
Correct.
bit, Dr. Makala.
Well, the OB-GYN profession or specialty has had several different formal subspecializations: high-risk OB, infertility, and oncology. And now, starting in 2013, many doctors have been working in urogynecology for many years. Now, in 2012, I think it was, they created a formal subspecialization, so people who have been doing this type of work have the opportunity over the next 3 years to take an exam and have formal subspecializations in this area.
So make sure you're going to the right specialist, Pat, all right?
Yes, right.
Okay, thanks so much for calling. Good luck to you.
All right, thank you.
Bye-bye. Teresa, you are on the line with Dr. Makala and Georgianne Van Usen.
Great. Now, should I have my volume down on the computer?
You're okay, Teresa. What's your question?
Okay. My question is, I have seen my main urologist who ran a bunch of tests, and then he sent me to a surgeon who also ran tests and did examinations and decided that I needed to have Botox for the bladder to make it. Actually, I don't leak when I cough or laugh or anything like that, but if I stand up to go walk or anything, my bladder just empties. And when she did an examination on me, she said that she thought my bladder was tipped.
Well, if you stand up or sit up and you leak, that's really suspicious for stress incontinence. Typically, Botox is a newer treatment for stubborn, overactive bladder patients. We typically try physical therapy, medication, and when patients fail medication, we're left with two other treatments. One is InterStim, which is a basically nerve stimulation of the nerves that operate the bladder, or Botox injected in the bladder. So your symptoms don't quite match up. Do you have urgency? Do you get the sense you have to go and you have to go now?
No, I've suffered 2 strokes, and my first doctor, Dr. Cotant, told me that he did believe that from the area of the brain that was damaged that I'm not getting the message that I need to go. So
Yeah, that's that. When you've had damage to your spinal cord or your like a brain injury, that sometimes can really impact the bladder function. So
yes, it does.
yeah, so it without seeing all your test results, it may be that that's what's going on, and Botox might very well be a great option for you.
Well, I decided I didn't want to try it because she said something about I had to use a catheter afterwards all the time.
Yeah, you need to be willing to. Not everybody needs to do that, but sometimes the Botox does too good a job, if you will, and you have some urinary retention. So that you don't expand the bladder or have pain, you need to be able to empty the bladder yourself. But not everybody needs to do that.
Well, that's comforting because she didn't spend enough time talking to me about it. And I really have enjoyed your show, and I know it didn't sound like it applied to me, but my husband said, please call. Because I chose not to have Botox, and I didn't know if there was anything else I should be doing.
Well, it's always good to ask those questions, and if you're not satisfied with your doctor, Teresa, find another, okay?
Oh, believe me, I do.
All right, thanks so much for calling.
Thank you.
Bye-bye. So let me ask you something, because I know in Georgianne's case, not only did she have the prolapse uterus, but she also had the hysterectomy. Do you always have to have a hysterectomy?
When you have severe prolapse, typically yes. I mean, if you want to maintain the uterus, we can manage prolapse in some patients with a pessary. But if we do a sacral colpopexy, which is a great repair, it's most commonly done with a hysterectomy. There are some centers that are not doing hysterectomies, but it seems that the results aren't as good in some cases.
I got to ask you, because I know you've seen the show now.
Yes.
What was it like to see your insides?
Well, I mean, I'm a nurse, so it's.
No, but to see
But to
your
see
uterus and
yeah,
your-
that was amazing because I have never actually.
and you saw that little fibroid
And
tumor.
the fibroid tumor, yeah, I didn't realize I even had. People said you didn't have any bleeding, and I said no, I didn't have any pain or bleeding. But I guess you don't have pain necessarily with fibroids, right?
It
Or
was
you
a small
can.
fibroid.
Yeah, and it was small.
Yeah, and it wasn't, the fibroids that protrude into the inside of the uterus are the ones that cause bleeding, and bigger ones on the outside can press on things and cause pain. That was on the outside, but it was pretty small.
Yeah, yours was very small. And sometimes they're so big a woman can look pregnant
Yeah.
Exactly.
just from the tumor.
Exactly.
So
Let's go to line 3. Oh, I'm sorry, line 1. Madeline is on the line. Hi, Madeline. Madeline, you with us? Madeline,
Yeah.
can you hear me? You're on the line. What's your
Oh,
question?
I'm on the line. No.
What's your question, Madeline?
Yes, I am, but I can hardly hear you.
Can you turn down your computer?
Let me wait. My phone is turned up all the way. I can see you, and I'm on the line.
Hi, Madeline. If you turn down your computer, you'll hear us better.
Can you hear me?
Yeah, we can hear you perfectly.
Yeah.
What's your question, Madeline?
Bye. All right.
Madeline, do you have a question?
All right. I had the mesh sling put in a couple of years ago, and since then, intercourse has. Yeah. Can you hear me?
Yes.
Can you hear me?
Yeah. Yes, we can.
Yes.
Madeline, if
And
you turn down your
since
computer,
then,
you would have so much.
I've not been comfortable having intercourse.
Have you seen a doctor since this happened?
Madeline, I'm going to have to let you go until you turn down your computer, okay? Sorry, Madeline. Madeline, if you want to call us back after you turn down your computer, that'll be okay, but we couldn't hear you. The basic gist of her question, though, is one we've heard again and again and
Right.
again, and that is, this is ruining my sex life.
Right.
What do I do?
Well, in her case, she said she had a sling placed, and now she's having pain. So sometimes she certainly needs to be examined. We see sometimes people will develop a little scar tissue, and if they remove that in an outpatient procedure, they're very comfortable. So I would encourage Madeline to be seen and be examined and figure out what's going on.
Well, we hope you get the help you need, Madeline. Let's talk a little bit more to Georgianne.
okay.
And talk a little bit about immediately after surgery, what you felt, because you knew it was going to be 5 tiny incisions.
Right.
And I remember the doctor saying to you, oh, you'll barely feel it, you'll recover quicker than you think.
Yeah.
Was he telling the truth?
Oh yeah, absolutely. He told me the truth. I have 5 little tiny incisions. They're healing perfectly. I never wore a bikini anyway, so who cares? But we joked about that. I said, now I can wear a bikini, right? Kind of like, can I play the piano? Not if you never did before.
Right.
But yeah, it's very, very minimal.
Now she's the comedian.
Right,
Yeah.
right.
Well, the only other thing, just so people know, you know, when you have surgery and you're on narcotics for pain, which of course you have to have for a couple days, you might become constipated. So that was my biggest thing. And I'm a big fiber person. I drink lots of water. So, but you know, your doctor, as Dr. Macklin did, gave me a stool softener, so that wasn't an issue. You know, that could be an issue, but as long as you're eating the fiber, taking the stool softener, and drinking the water, 6 to 8 glasses a day, you're doing fine.
Wow.
So-
You're good about that, huh?
Oh yeah,
And now you don't mind doing it because you're not afraid of leaking.
that's right. I don't have to worry about a pad.
Has it changed how much you drink in terms of coffee and tea and
Oh.
wine or whatever?
Yeah, well, I always drank a lot of water regardless. I just wore a bigger pad, that's all.
Really?
Yeah, and went to the bathroom more often.
Wow. So what surgical, for the people who are now listening and really want to know, because we've had a lot of women call who really aren't candidates, let's say, for robotic surgery.
Right.
What are the conditions that we can absolutely treat through robotic surgery?
Robotics. Well, certainly prolapse we can, and recurrent prolapse, the robot works wonderfully. Fibroids, we can remove many fibroids and do it in an outpatient basis. For some endometriosis, there's some studies suggesting we see more lesions, maybe 3 times as many as a traditional laparoscope. So just the improved visualization is a big bonus. If we can see it, then we can treat it. Hysterectomy, robotics is not always indicated. In a tough case, it might be the ticket, but there's vaginal hysterectomy, there's laparoscopic hysterectomy, and there's robotic hysterectomy. So in that case, there might be some other great options.
What other procedures can be done at the same time? What can you take advantage of while you're already in there?
Well, many times, if somebody has a lot of different problems, we end up doing robotically a hysterectomy, a suspension procedure. We'll support the neck of the bladder. Some patients have fecal incontinence and they elect not to do physical therapy, so we can put the rectal sphincter back together. We can do all those at one time, and people are, the more we do, then they're a little bit more sore, but it cures a lot of problems.
Can you give that list again, like you did in surgery, of everything that you did to Georgianne?
Right, we did that's off the consent, and it's a lengthy list. A total laparoscopic hysterectomy, a bilateral salpingectomy, a sacral colpopexy, a bladder sling, midurethral sling, and a cystoscopy.
All that on you.
Yes, I know.
And you feel great now, right?
I feel awesome, yeah.
So what would you say to the women watching?
I would say that if you have any of the issues we've discussed, if you know that your bladder or your uterus or your rectum is prolapsed into your vagina, go to the doctor, preferably see Dr. Makla. I have to say that because I think he's the best. But see somebody, and you can have it fixed. So
All right, let's go to line 2. You are on the line with Dr. Paul Makla and nurse Georgianne Van Usen. Caller, are you there?
Yeah, I'm here.
What's your question?
Oh, okay. Are you listening?
Yes, we are.
Okay. In 2011, I went and had a pap smear with a new doctor, and I didn't want the pap smear, and she told me, well, I probably have some kind of disease. Maybe I could have had it when I was younger. So finally, she talked me into it, and when I went to have it done, I told her then I needed to use pediatric tools. She used them, and as soon as she stuck the tool up there, I started screaming, and I was screaming and screaming for, I don't know, probably 10 minutes. And then she decided to take it out and get the pediatric one, and then that didn't work. I was screaming continuously. I hadn't had sex for like 10 or 12 years. And so she then took it out and sent the thing to Speedway Hospital, and the results were just really horrible. And everything was ripped up inside of there, and then was also, it was very bad. I didn't go into detail.
Okay, so what's your question for Dr. Makla?
So what happens is that I urinate all the time. I use about 18 rolls of toilet paper a month. I'll be walking around. It'll start dripping down my leg. And now my bowel, I go to the bathroom more than I normally ever did before.
How old are you?
71.
71. Yeah, if you're having, if you're having bladder problems, you should and it's bothering you, it's interfering with your life, you should be evaluated by somebody to figure out what the problem is and what the potential treatments are. Not every treatment is surgical. We have a variety of non-surgical treatments, and then you can pick which treatment makes the most sense to you.
Okay.
And if you go to someone who you don't think is treating you right, go to someone else. Find the doctor who will work with you. All right?
Okay, well, does he actually do that doctor, or no?
Does he actually...
do you actually do it, she's asking?
Do what? Which?
Well, like go in there and do a repair?
If you need a repair and that's what you choose, yes.
But surgery isn't always the answer. Go in and get a consultation.
Oh, okay.
Okay?
Okay, thank you.
Thank you for calling. The number to call at St. Joe's is 855-SJ-ROBOT. I'll take one.
Tell me again what it is.
It's 855-SJ-ROBOT. St. Joe Robot. 855-SJ-ROBOT. You got that?
I got it.
All right. Good luck to you.
Okay, thanks.
I'm
Bye.
going to take one last caller. You are on the line with Dr. Paul Makla and Georgianne. What's your question?
My question is, am I too old to have the surgery?
How young are you?
94.
Wow.
You sound so young.
You really do.
What problems are you having?
I have a prolapsed bladder and rectal incontinence. I've had a hysterectomy about 20, 30 years ago. And I've been to see a urologist a week or so ago. I saw the nurse practitioner. She referred me to a gynecologist. I went to the gynecologist, and today I got word from my primary doctor that she did not recommend surgery. My primary doctor is Tim Thomas. The gynecologist was...
Well, here's the thing. If your doctor's telling you you can't have surgery, that's a big deal, right?
Right. Yeah, if you go to a surgeon and they say, we don't think you should have surgery, I would listen. But if you're in your 90s and you have prolapse, I mean, one of the first things we try is a pessary. And that works great for a lot of patients. I won't say it works for everybody, but that's a great first-line therapy.
And you don't recommend surgery?
I would be trying non-surgical options first for you.
Yeah, try everything you can before you go to surgery. We don't always jump to surgery, even with young people.
Correct.
Uh-huh.
Alrighty?
Well, I guess that's what I wanted to know.
Thank you so much. We wish you the very best.
Thank you.
All right, take care. Bye-bye.
Bye-bye.
Thank you so much to everyone who has called in. We think that it's so wonderful. Good that we're talking. By talking, we can actually find answers, get help, as Georgianne did.
Yes.
You want to say anything, one last thing to our viewers?
Just get some help if you have any issues.
Because it's really changed your life.
It's very much changed my life, yes.
Dr. Mackle, a last word?
I agree. If you've got a problem and it's limiting your life, don't live with it. Seek out answers and seek out other therapies and resume those activities.
I'm just so thrilled when people talk about issues they don't usually talk about. That's when we get answers. And so thank you so much first to Ann Gale and also to you, Georgianne, for talking about this. Dr. Mackala, for really finding some wonderful answers and for really saving people's lives, giving them their lives back.
Yes.
Thank you so much. If you're interested in more information, the number to call, 855-SJ-ROBOT, or you can always go to stjoeshealth.org/robotics. I'm Lila Lazarus. Thanks for watching.